In the 13 years since a gunman opened fire on the campus of Virginia Tech,
former classmates say the English major wrote violent, perverted plays and that his odd behavior made them nervous.
millions of dollars have been spent to fix the cracks in the state's mental health care system. Over the past few months, the issue has taken center stage again, with demonstrators from Richmond to Rochester calling for lawmakers and police to change the way officers interact with people suffering from psychiatric problems.
My brother Marcus David Peters absolutely deserved help, not death.
But long before the pandemic and the protests, one small town sheriff's department has been trying to figure out a better way to address the issue.
It's absolutely paramount.
Lieutenant Casey Mewborn is the head of crisis intervention training for the Middlesex County Sheriff's Office.
For law enforcement, you are only required by DCJS to get the first 8 hours of mental health training in the academy. There's requirements every 2 years for us to get legal, cultural diversity, and then career development, but not anything for mental health.
Which is a problem because the number of calls for people suffering from psychiatric crisis is growing, but the number of deputies is not.
And we have as little as one officer on the road for any given shift.
And there's another issue that Mewborn says has been handcuffing officers, one that emerges after a psychiatric patient has been taken into custody and brought to the emergency room to be checked out. If a person is ruled to be a danger to themselves or others, a temporary detention order is issued. Then, once the patient is medically cleared, the officer is responsible for transporting them from the ER to a psychiatric hospital. But that trip often stops before it even starts.
We're saying we're ready to go. I got a court-ordered paper that says they have to go receive psychiatric treatment, and that this ER is not an acceptable place for them to receive that treatment because there's not a psychiatric doctor here.
Under state law, if no other psychiatric beds are available, a state-run mental health care facility must accept the patient. The closest such place to Middlesex is Eastern State Hospital in Williamsburg. Closest in theory, according to Mewborn.
They won't let their doctors talk to the ER doctors. They're supposed to take them, they have to take them. Their end game is they're saying that they don't have beds available, or they're not staffed enough, and they're trying to free up that asset, but meanwhile they're holding law enforcement hostage, they're holding ERs hostage.
The patient cannot be released from custody, so the search begins for another psychiatric hospital with an available bed, which can take hours, essentially leaving the small sheriff's department a man down. It's putting public safety in a bind.
100%.
And sometimes taking the deputy and the patient very far from home.
First place I've taken personally would be Roanoke, but we have had officers go out west towards Tennessee.
To put that in perspective, Roanoke is about 250 miles from Middlesex.
My total workday that day was 20 hours.
And this problem isn't limited to the outskirts of Central Virginia.
It's frustrating for everybody.
Dr. Joran Securia is with the Virginia chapter of the American College of Emergency Physicians.
I feel like we could be taking care of our psychiatric patients better by just making it a simpler process.
She says state hospitals are being overwhelmed right now with psychiatric patients, something that has been made worse by COVID-19.
Now we have less beds at each of the psychiatric hospitals because of social distancing.
She sympathizes with law enforcement, but her biggest concern is the health of the patient forced to wait for help.
They're not getting the psychiatric care they necessarily need, which is group therapy, individual therapy, the right medications, because we're not experts at that.
So what can be done to fix the problem? Securia tells CBS 6 that too much time is wasted during the bed search process, so an updated and streamlined statewide registry could help. Mewborn says a regional partnership that allowed off-duty officers and deputies from 10 counties to take over custody of patients from their on-duty colleagues was working, but that has run into funding issues. The state also recently rolled out a new alternative transportation system, but it has its limitations.
But they only take over once a bed is found and the patient is ready to go. Like walk out the door. They don't come sit in the ER with them.
But he says the top priority needs to be fixing what can best be described as a communication breakdown.
The biggest thing is to figure out why the state hospitals, and it's the state hospitals giving us the most heartache. The ones that are not, their doctors are not calling and not contacting and holding up the patient.
And getting law enforcement out of the waiting room and back on the job.
we've always put a Band-Aid on every problem. We get it fixed. Well, now we're left with that Band-Aid, and we're fixing it, but at what cost? It's costing our public's safety and our public's care.